All right, joining us now, University of Maryland economist and business professor Peter Morici. Peter, always great to have you. Let's talk about Kamala Harris. She is pivoting on this sort of progressive messaging a little bit. First, whether it was fracking, we want to ban fracking, now we're not going to ban fracking, or if it's Medicare for all. No, they're kind of floating it out there that, no, she won't do that because they understand it might not be popular for voters. But how can we trust the Harris that might be president of the United States? Who do voters think they're going to get in November?
They're going to get Joe Biden. After all, remember Joe Biden was running against Bernie Sanders, and in South Carolina he says, turn to me, I'll be a moderate, I won't be so extreme. And he got elected, and then he basically put AOC and Bernie and the rest in charge of his agenda. And I think the exact same thing will happen with Kamala Harris. If you want to know what health care will be like in a Harris administration, then go stand in line at noon at the post office and wait and get moribund service. That's what it'll be like seeing the doctor. Kamala Harris becomes president and gets her way.
Oh, no good. I don't like that. But I want to ask you about something that is interesting. Former President Trump said on Truth Social, hey, why don't we stop taxing Social Security benefits? Seniors shouldn't have to pay that. I think that's very popular, Peter. What do you think?
Well, the fact is that I'm paying taxes on Social Security benefits when I already paid taxes on the money going in. So I'm being paid taxes twice. I'm really not getting much out of those Social Security benefits. When you think about it, I paid about 40% of my income going in, and I'm paying 40% coming out. Basically, the money's round tripping, but as it round trips, so much it gets taken away. I think it's a silly situation, and I think they shouldn't be taxing Social Security.
I want to talk about Social Security and Medicaid. There's been a spin from the left that Trump or other Republicans want to cut those. Dispel the rumor for us. Indeed, no cuts to those, correct?
Well, I don't know that there'll be no cuts. I think the social programs will have to, the safety net's going to have to be cut in places. But you got to remember, Medicaid was established to help expectant mothers and children. It wasn't established to assist deadbeat guys who don't want to work or are 45 years old and they're staying out of the labor force. The thing has become income-based, and it's become arbitrary and unfair. And my feeling is that we ought to limit government health care benefits to those who are working very hard but maybe can't afford to get it all, so you give them some help. But certainly those that are working, not people who just choose to, don't have parental responsibilities and don't do much of anything. It's the same thing with food stamps.
Yeah. Peter, thank you so much for being here. We always love having you on the program.
Take care.